Please, can we start the live stream, please? Okay. Good evening, everybody. Thank you for attending this first meeting of the Overview and Scrutiny Committee on Thursday, the 1st of July, and welcome to the new members of this committee. I hope lots of new faces here tonight. My name is Councillor John Walker. I'm the chair of this committee, and Councillor Lees is the vice chair of this committee. We have some members, well, we have lots of members present in the Lancashire room. We have some working, joining from home on Microsoft Teams, and members of the public observing live on YouTube. If you're present in the Lancashire room, please raise your hand when you wish to speak. When I invite you to speak, please turn on your microphone, and when you are finished speaking, turn it off. If you're joining virtually, please keep your microphone muted and video turned off when you are not speaking. If you wish to speak, please use the raised hand function on your iPad to make any comments. This is to ensure that members have the opportunity to speak and that no one is speaking over another. Please take into consideration that the technology we are using is new and unfamiliar. I agree entirely with that. It'll take a lot to get used to, really. But if it fails, I will adjourn the meeting while the issue is being resolved. If this is not possible, a new date and time will be organised. Please can all members in attendance respect the COVID measures in place. They are there for everyone's safety, and please ensure any mobile phones are switched off. We are not expecting a fire drill, so if the alarm sounds, please exit the way you came in, which is down there. Matthew, have we got any apologies?
There's no apologies, Chair, but Councillor Snape and Molyneux maybe
Councillor Molyneux was given apologies, but she might join the meeting later this evening. Right, can we start with agenda item 1, which is the minutes of the meeting Thursday the 18th of March. Can I have a proposer for the minutes? Thank you, Councillor Lees. Anybody else who was at that meeting in March? Probably not. So, I'll second it. Is that all? Can I second the minutes? Okay, thank you. Are all those in favour of the minutes of the 18th of March? Again, if you weren't here, it is a true record. Councillor Lees himself will agree to that. We move on to item 2, which is declaration of any interest. Members are reminded of their responsibility to declare any pecuniary interest in respect of matters contained in this agenda. If you have a pecuniary interest, you must withdraw from the meeting. Normally, you should leave the room before the business starts to be discussed. You do, however, have the same rights to speak as a member of the public and may remain in the room to enable you to exercise that right, and then leave them immediately after. In either case, you must not seek to properly influence a decision on the matter. Any declaration of any interest? No? Okay, thank you. Move on to item 3 then. Public questions?
There are no public questions, Chair.
Thank you. I'm just going to alter the agenda slightly. We have with us tonight Councillor Hilton, who is a member of the Health Scrutiny Committee at Lancashire County, and he is going to give us a resume of what's been happening at County as regards health. So I'm asking him to, if he'll join the meeting now and give us a report on the meetings he's attended. Councillor Hilton.
Yeah, thank you, Chair. Can everyone hear me there okay? Can you hear me okay?
We can hear you, Councillor Hilton, but you're not on video.
Okay, no, that's probably not a bad thing.
Okay, thanks.
Thanks, Councillor. Right, good evening, Chair. Good evening, councillors. Just for those of you that don't know me, because obviously there's a few members of the committee that are new and quite a lot of new councillors. My name's Alex Hilton. I'm the newly appointed lead member for health for Chorley Council. Just a little bit about me. I've got an NHS background. I qualified as a radiographer in 2000 and I currently work as a clinical scientist, and I've had experience from all levels, from the front line up to strategic as a foundation trust governor. So just setting the scene about me. I am newly appointed to this role, and I've only actually been able to attend one meeting so far. There's only been one that's gone forward, and that's the Lancashire County Council Health Scrutiny Committee. The meeting was more of a workshop about setting the scene about what's going to be happening in the future as part of the Health Scrutiny Committee. So there were a few presentations and then questions from some members about what is actually happening and what is going on. Our health outcome.
Councillor Hilton, can I just ask you, we're not hearing very well in the Lancastrian. If
Right.
you slow down the way you're talking, we might.
I can slow down, yes.
Not
That's
better,
fine.
really. I apologise for that, but we aren't hearing it very well in the Lancastrian. Thank you.
Okay, right. So the health scrutiny meeting, it was mainly a workshop about what was going to be happening in the future. There are some quite significant changes coming to the National Health Service. In Chorley and South Ribble and Central Lancashire, the Our Health, Our Care programme has been discontinued in favour of the introduction of integrated care systems within the NHS. So the first item on the agenda for the meeting, there was a presentation by Healthier Lancashire and South Cumbria, which are a partnership of healthcare organisations across the region. So they're explaining about the white paper for NHS reform, which is expected to begin imminently, really, if the bill goes through. I think they've got the second reading in Parliament in July. And hopefully we'll start the process from October onwards, ideally completed by April 2022. But obviously we've got a bit of an elephant in the room of COVID, which obviously would have to take priority. So an integrated care system in Lancashire and South Cumbria is a partnership of local NHS providers and local authorities. And there are 5 sub-regions within the area, and Chorley is part of the Central Lancashire sub-region. And the plan is to join up services and to make them more integrated. Currently in the National Health Service, there's a lot of competition between different providers, whether they be from the NHS as a foundation trust or whether they be from the private sector. And one can outbid the other for different services. Part of the integrated care system is to actually slow that down and somewhat reverse it. And what they're looking at having is providers that are working together to provide integrated care for patients rather than working against each other. So that seems to be a positive step forward, rather than working against each other to get the work into the different hospitals. We've had guidance recently about services being much more collaborative, and that includes the voluntary and community sector, also known as the third sector, and they're going to be a key partner in the relationship moving forward. The NHS body for Lancashire and South Cumbria will actually receive funding rather than clinical commissioning groups, which are due to be disbanded. So this process is taken forward, and there's going to be a lot more interaction with elected members on the local and parliamentary level. And communities will be able to have much more involvement and try and effectively organise ourselves to support the process. So members at the Scrutiny Committee asked a few questions about how things are going to change moving forward. They're saying that we've got a lot of catching up to do of routine work. And they were looking at whether we could look at basic information on waiting lists, then we can measure improvements. So the response to that was we can measure improvements looking at national NHS figures, as well as a broader measure of health and wellbeing, and that will be built into the scrutiny programme moving forward. Members asked about the impact of reorganisation on the ability of the people involved in terms of actually getting things done and what we're doing to mitigate risks. The response was there's obviously going to be risk with organisational change, but there needs to be approached on a case by case basis, but there will be some disruption, but that will happen in any kind of organisational change. They were asked about the voluntary sector or the community sector and whether there'll be a budget for this. There will be some form of budget, but it's not made quite clear yet as to what's going on. And then they're asked about staff shortages, how we're planning to cover for this, and are we working with universities to look at additional training places. So we can look at the current workforce plans to address this, and again, that can be built into the scrutiny process moving forward. We also had a presentation from the Director of Adult Services for Lancashire County Council, talking about collaborative work with the 3 neighbouring upper tier councils as part of a major provider for Lancashire and South Cumbria. Lancashire County Council is still subject to competition, possibly against private companies such as Virgin Healthcare, probably less so than the NHS trusts. Again, there was emphasis on collaborative working rather than competitive working, but there was an emphasis put on democratic involvement at county level. We're going to be looking at the hospital transformation programme and opportunities for new hospital programmes and alliances of hospitals working together. There's examples of that in Manchester at the moment. We talked about COVID recovery and the significant impact on social care and service providers, and we're looking at ways in which we can measure how we can actually determine that we're actually being affected in terms of the COVID recovery. But again, that is a fluid situation because we don't know what the future holds with COVID. And there's also work about health inequalities being addressed, particularly people with learning difficulties, especially during COVID. Due to restrictions. We went on to talk about liberty protection and safeguards and decision and capacity, and there's new legislation due from April 2022 to try and simplify the system, but we're still waiting for a code of practice from the Department of Health on that, so there may be delays again due to COVID. We also discussed looking at changes at the Care Quality Commission, and they're going to be scrutinising adult social care as well as NHS providers. And members then had the opportunity to ask about early intervention, and there's a bit of a vague answer. They need to look into that more, and they will include that as part of the scrutiny process. And members also raised concerns about the workload of the Scrutiny and Health Committee. Is it too much? So they're going to look at individual items that have come up and come up with a short list as to what to concentrate on. We then had a presentation from Abdul Razak, one of the public health consultants, talking about priorities for public health moving forward. Public health has moved back into the local authority from the National Health Service a couple of years ago. And again, it's mainly on COVID response and measuring targets to actually see that we're meeting the response, particularly in terms of vaccinations. And they're looking at health inequalities, particularly with children. And then there was just a basic presentation from Health Watch about community and public involvement in the process moving forward. Members asked about digital services in COVID, and Health Watch are looking into that specifically, especially for patients that find it difficult to access services digitally, such as those with dementia or learning difficulties. So there was a lot on, and it was just more a better scoping exercise on where we go from there. There were a few questions asked about the chair. Asked to the chair rather about timetable, and members were concerned that winter planning was only done in October previously, and we need to start looking at it now, including COVID booster vaccines and flu. And there was also questions about high intensity users on how we're not actually meeting their needs at the moment. A lot going on, and it was just a scoping exercise. So this is what the Scrutiny Committee will be looking at this year, and I'm happy to take any questions on that rather large amount of information I've just given you.
Thank you, Councillor Hilton. Anybody got any questions? Yes, sir.
One important question is the funding of health resources. We're going to move from CCGs to integrated care systems. Now, from what I can see of this is regional allocation of resources by any other name. Is this going to lead to regionalisation of services? Because at the very least, with the CCGs, we had them in areas where there was local accountability, local councils. Is this going to be a step towards lack of accountability?
It's difficult to answer that because the honest answer is we don't know at this point in time, and we have to see what is happening. You're quite right in what you're saying about money will not be going to CCGs anymore. It will be going to Healthier Lancashire and South Cumbria. So there will be a regional allocation funding. But what they need to look at is what they believe is the best model of care overall for Lancashire and South Cumbria. And at that point, they will then allocate the funding accordingly to what they believe is the correct model of care. And we're not at that level yet where we know what that is going to be. But there is potential for that to happen under the current system, yes.
You want to respond, Councillor Howard? Yeah, happy with that response?
We've been very proud in Chorley of a local hospital. And 5 years ago, when it was suggested that the accident and emergency service was going to close down, we virtually needed an intervention of the Minister of State to actually return it. And it is a worry in this area by a lot of people because we've got a lot of poverty in this area. If we start talking about regional-based hospitals, a lot of people will not be able to get there, quite simply. And it is a worry, and I'd like you to take this on board and possibly get answers to where this is going to lead us.
You're quite right. There are serious concerns about this, and I don't know what the model of care for Lancashire and South Cumbria is going to be yet. Nobody knows that, so I'm not in a position to answer that question. But I will certainly make sure that the views of Chorley are absolutely represented throughout this entire process, definitely.
Okay, Councillor Howard. Sorry, was there any discussion at the committee about the reaction of Lancashire to the COVID pandemic?
This was mainly a scene setting about what's going to be going on for the future. There was a lot of talk about COVID, particularly in terms of public health. There are some concerns about vaccinations, and that is the public health priority to actually get as many people vaccinated as possible. But the main concern was really about the backlog of routine care that has basically gone on the back burner since COVID started, and about how we're actually going to look at basically catching up on the routine work that we've not done. So that was the main emphasis of it: vaccination and catching up post-COVID.
Thank you. Are there any further questions for Councillor Hilton? Okay, well, thank you, Councillor Hilton, for your report. Presumably, in the near future, the county health scrutiny will look at COVID after it's all over and look at whether they've done well, they haven't done well, or anything that needs to be done if we get any further future pandemics. So thank you for your attendance tonight, and look forward to hearing from you at the next meeting. Thank you.
Thank you, Chair.
Right, can we go on to item 4? Item 5, which are the consider the executive cabinet minutes of the meetings held on the 25th of March and the 17th of June. One was before the election and one was after the election, so some people remember the March one, but hopefully you'll all remember the second one. Are you all happy with the minutes of those two meetings? Are there any questions you want to raise? No, okay. We'll note the report. Thank you very much. Move on to item 6, which is the notice of executive decisions. Now, there are numerous decisions being made, looking forward and looking back. And it's a question really of whether, as a committee, we want to look at any of those decisions that are going to be made. It is too late for the ones that have already been made as regards calling and what have you. But I'm certain that with the number of decisions to be made, we could look at any, if you've got any concerns. I've got one, but I can get to that area. It's on page, notes, page item 32. Page, I've gone past it. Page 32. It was the leisure contract, which is currently being run by Chorley Council. I just want to get an update of where we are with that and whether we should be looking at it in the near future, if it's going to come back to Cabinet or not. I'm there now. No, I'm not. It isn't. Oh, crikey. Something's going wrong with my computer here. My apologies. Yes, it mentions there the leisure contract update. There's no earliest date for the decision to be made, so presumably it will be coming back to a Cabinet in the near future. Chris, have you any comment to make about it?
Yes, I'm just looking. I think it's on mine. It's on agenda page 18. For anyone who, I found it on agenda page 18. I will look slightly at Ruth because I suspect I probably put this onto the executive forward plan and I'm waiting to be corrected. But I think this is from an earlier time and went to full council for a decision. So members will recall that the council had been undertaking a procurement exercise and reached the end of that procurement exercise around about this time last year, July time, and we appointed a preferred bidder. Unfortunately, just prior to that new contract starting, the preferred bidder withdrew from the process because of the challenges that they'd been put in through COVID-19, and they did that right at the end of August last year. On that basis, because the contract with Active Nation, who had managed the leisure centres on our behalf 15 years, was coming to end at the end of September, we had a very limited period of time to make a decision about what we would do. The General Purposes Committee, on behalf of the Council, made a decision that it would make provision for, in the immediate future, the Council to take over direct management. And that happened in advance of the 30th of September, and we tubied the staff into the Council's employment. We have then undertaken a piece of work, as well as restarting leisure provision in line with various up and downs of restrictions. We undertook a piece of work to look at the best option for the management of leisure centres. That was presented to full council in April, I think, but I stand to be corrected on the exact month, but in 2021. And a decision was taken by council at that point that the council would establish a wholly owned company to manage its leisure centres on its behalf. The leisure centre staff would be tubied into the wholly owned company, and that would be established. That work's ongoing at the moment in the background. We have established the company, so it exists, but really exists on paper at the moment. And in the coming months, the staffing resource will move in there, and all the various governance arrangements will then be in place for the management of the contract that the council will have with its wholly owned company to run the leisure centres. In terms of own scrutiny, if you're wanting to look at it and see how it's getting on, I would suggest that probably September, October time is a good opportunity, because at that point the leisure centres will be managed by the wholly owned company, which will be established, and there is still an outstanding piece of work to do around the longer-term business plans for the leisure centres, and for members who were on the council prior to the all-out elections. You'll recall that we have put aside some money to undertake transformation work within those leisure centres.
We'll wait to, will there be a report going to Cabinet in the near future?
Possibly, but I wouldn't like to guarantee it, because quite a lot of it will be run through the wholly owned company and those decisions. I don't think there's any outstanding decisions to be made by the Cabinet, albeit that they might get some updates. So if you're wanting a kind of specific, more detailed update, then it's probably worthwhile putting that onto your forward plan.
Yes, thank you. Yes.
Thanks, Chair. I'm just looking at agenda page 51, grant of a lease cafe from Rose Gardens. I just wanted to see if there's an update on that, and have we got any plans for the future for us to go in there yet? If that's possible, please.
I'm probably not going to give you an entirely helpful answer, because the honest answer is I don't know what the exact latest position is. I know that we have done. We've got the hairdressers up and running, and that chair is running. But I can find out and come back to you.
Can I ask the officer? Basically, a lot of the decisions have already been made, but are still on this report. Shouldn't they be, when they've been approved by Cabinet or Council, shouldn't they be deleted from the?
Yeah, just to confirm, Chair, as it is correct at the time of publication on the agenda. So on the agenda, there is an interactive link to the plan as it is today. And on the plan today, the items that were at Cabinet have been removed. So it's stuff from today onwards.
Thank you. So if there's a lot of decisions going to be made over the next few months, if there's anything you feel that we as a scrutiny committee should be looking at it, please let me know, or let Matthew know, and we'll decide whether we can fit it into the next scrutiny meeting, which is in October. Okay. Any further questions on Cabinet decisions? Okay, thank you. We'll move on to the next item, which is Chorley's response to COVID-19. Chris, thanks for being here tonight to give us an update.
Your spot, I'm looking slightly nervous because I've been given a clicker, which I think is the main response. We had this before, but this is definitely what they needed in 10 Downing Street for most of the last 12 months. So, Matthew, am I allowed to press it now? I am, right. So thank you very much for inviting me to come and present to you. Obviously, we have been doing a lot of work and a lot of activity over the last 15, 16 months to respond to COVID. I have attempted to encapsulate it within the presentation that I'm going to give you, but obviously I'll be able to hopefully answer any questions that you've got. I suspect actually you will find quite a bit of information in the Council's annual report for the last financial year, which will be due to go to the next full Council meeting. So you will see some information, albeit in a slightly different form, presented there. We're really pleased with ourselves.
Any questions? I've got one or two.
Hang on, now, if you want me to keep going, John, then I'll give it.
You're going through it.
I think that works then, otherwise I'm going to revert to the next slide, please, and make Matthew do it. So what you will spot through the presentation is what I have identified as some overall themes. You may pick up different ones, but I think it's just useful to highlight it. A lot of the Council's response to COVID-19 actually built upon pretty strong foundations that were already in place from the work the Council was undertaking. So you will see that, particularly in our support of the community, whilst we hadn't necessarily run a significant food programme before, a lot of the principles that we had developed through our community resilience framework was the approach that we adopted to providing support to the vulnerable people who were shielding and needed our support. The organisational management and much of the ICT and information management that we've been working towards over the last decade or so also provided a significant amount of support in enabling us to continue to deliver our services in what was an extremely different format than had previously been done. You will definitely see a massive amount of commitment and flexibility that the council staff demonstrated. People took up jobs that they had never ever done before and probably never conceived that they would be doing. That included, using an example, the person who normally manages the museum service running our food distribution service for a period of time. It included people from the policy team making phone calls of people who are shielding and vulnerable to find out how they were. So we had an enormous amount of staff who continued to do their jobs but actually take on new jobs as well. We also actually didn't stop having the challenges and other work that we had going on through the year. I've mentioned the leisure centres in my previous answer. We had service demands that continued and actually democracy because we were working towards all-out elections, albeit the elections were originally scheduled for last year. We still had to run all-out elections, PCC and Lancashire County Council elections on a single day at the beginning of May. It's probably the biggest election that we've ever undertaken, and added to that, we did it in COVID-safe ways. I was actually working for the count over at South Ribble. I got all my steps in because we were doing it in the tennis centre and it was massive. And then we do need to recover. We do need to look at how has COVID affected the community and the organisation, and you'll see that theme coming through. So just starting in March 2020 and the initial response, we have in the council emergency plans and business continuity plans. But Chorley in particular in the past, they have largely focused around major fires. So one a couple of years ago in Adlington, or floods, particularly in Croston, but actually in other areas around the borough. We established a business continuity management team. We did that on a shared basis with South Ribble because it meant actually we could coordinate the response across the two councils and do some mutual aid and support to each other. I chaired that, and that team's job was to make sure that we managed the response, we knew what was an issue, and we were able to make decisions as quickly as we could. We also supported the work of the Lancashire Resilience Forum, which is the county-wide partnership that includes all the district councils, the police, fire service, unitary councils, and actually for much of the last year, the military providing aid in terms of planning. Gary, as our chief executive, concentrated a lot of his efforts really from March through to about August or September, were concentrated in supporting the work of the LRF. It doesn't exist. The LRF is not actually a tangible thing. It is a partnership, and when something like this happens, it needs to call on the resources of the partners who are Category 1 responders. Our very much initial response was to keep our staff safe and services running. You probably can't quite see it there, but there's two photographs. One is how do you tell who's using the toilet when you've got a solid door there? So we had to go around and make sure that we were very clear about the maximum number of people who could be in the building and how do we keep them safe whilst they were having to work from there. One team in particular in that first response worked very, very hard, and the bottom picture there is our IT team setting up about a dozen laptops at once to get that out to staff who needed that IT hardware to be able to continue to deliver services. Through the business continuity management team, we also had to make decisions and keep services such as refuse collection running. Now, we were very lucky, actually, through the whole of the last year, whilst there have been challenges, and you will see that in some of the missed bin collection information that you see in the quarterly performance report, The contractor who runs our waste collection service has managed to keep running, but we did have plans in the background for how we would continue to keep the core service running if we had staffing issues. And so all that needed to happen in the background. Unfortunately, it wasn't actually needed. And then finally, keeping members informed and supported. So in that first period, there was very much a focus inwardly and into the LRF to keep that core service and support going. But actually we are accountable to you, we are accountable to the council, and there was a lot of work undertaken within democratic services to keep members as informed as possible, whilst there was lots and lots of activity happening, enabling councillors to do their role as ward councillors and supporting their local residents. There was also actually a lot of work done by Ruth and her colleagues in actually making sure that our councillors were safe and happy. So quite a lot of calls round to members. Moving on, I've split this now looking at the different categories and cohorts of people that we were supporting. We undertook a lot of work to support our communities. And as I said before, we already had a very active presence in our communities and working with volunteering community groups. Over that time, we've worked with volunteers and communities and using our own staff to support over 3,000 households. So this is from the start of the pandemic right through to date. We've made and received over 4,700 contacts. At this time last year, we were receiving daily updates to the shielding list. We would then contact those people. We would also be taking phone calls from individuals, and you'll see a quote at the bottom there, which is from Tom, who works within our communities team, who was manning the phones, or part of the team manning the phones. And what he said is that people had managed for as long as humanly possible. They tried to keep things going themselves, and actually they phoned the council as their last resort. And he said that you could feel the kind of tension easing off them as they realised that actually the council was there and was going to be able to help them. We provided over 1,000 food parcels, and we also mobilised the community and kind of harnessed the support within the community and the wish to do something. We did that by establishing the Chorley Together group, which continues today. And some of those photographs, just to run through them. The person in the top left works normally on fundraising for Inspire the Youth Zone. That's her dropping off the 1,000th parcel to a resident, because they provided a massive amount of support, not only in supporting young people who were particularly vulnerable, they also went out and supported the rest of the community in terms of food provision. I think that's Tom showing off his biceps on the right-hand side one, because he's decided to carry 2 very full bags. We had the depot turned into a food hub where we made up the food parcels that were coming in. At Christmas time, we realised there were still people who were shielding and unable to see their families, and so we expanded the work that we do with local community groups and churches. And you can't quite see it there, but that's pews in St Lawrence's, every single pew overflowing with presents, which we then worked with community groups to get out. And then at the bottom, a couple of examples of some of the food provision that we supported. So some curries that were made and supplied using food that was provided by the Chorley Green Living Group. Now on the right-hand side, pizzas, which we gave out from Domino's via the United Reformed Church, which has a fairly solid group of people who are vulnerable and have fairly ad hoc accommodation. So that might be that they sometimes rough sleep and they sofa surf. This was a place for them to be able to come and safely get food. Businesses were also obviously massively affected. It's fairly well rehearsed that the government made a lot of funding available to businesses. Local government was the main delivery arm for all of those grants. We have managed 11 different grant forms funds. So they overlapped, they had differing requirements, they changed requirements sometimes part way through, and that goes from everything from additional restrictions grants for driving instructors through to the full original scheme that was launched this time last year. We've processed over £40 million worth of grants to businesses. We've also supported and dealt with inquiries from over 4,000 businesses. Alongside that grant giving, we've also continued our business support programme, but tailored it to support businesses for the challenges that COVID posed. We had 70 plus businesses taking part in our free webinars of that support. 32 businesses also booked in with us, with our business advisors, to get a financial health check. So trying to continue that work that we normally do, but to really tailor it into the needs of businesses during COVID. And then we also set up a whole new team, which is still working. We were one of the first councils to take on the Zero COVID programme, which is local government taking over from the National Track and Trace programme. We have a team who do phone calls to anybody who's been told to self-isolate, and if necessary, we'll also go and do support visits face-to-face. We've got a 95% success rate, which is significantly better than the one that was being achieved by the national service. We've dealt with, I think, about 4,000 calls. 1,400, it was 4,000 for the other one, reading my wrong notes. We also helped our local primary care network, or one of our local primary care networks, to establish, firstly, a safe place for them to be able to work. I think they called it a hot and cold site in the initial phases, by having porta cabins placed onto West Street. That also then transferred and became part of the vaccination programme for the primary care network. We established and staffed a lateral flow testing centre in Buckshaw Village. We've closed that down now because actually it doesn't have the same need now that lateral flow testing is more widely available in places like pharmacies and through schools. We are supporting and have supported the vaccination bus, although I've not been to see, I don't know whether it's a bus, I think it might be an articulated lorry, vaccination centre on Friday Street, and have also been pushing through public health colleagues in the county to try and get a more targeted service into the communities where vaccination rates are somewhat lower. And then we can't forget our core services and key projects, and we pretty much kept those going. So we kept on track with our plans that we had to establish shared services in all the back office services. We undertook service reviews, we established new terms and conditions and pay grades, and that happened during the last year. We also agreed a further expansion with the shared senior management team and moving into phase 2. We continued, albeit it was somewhat delayed, and we had to tweak some of the timescales with some of our major development projects, such as Tatton, Westway and Astley Hall, which have started to be revealed as they take down the scaffolding in the last week. As I've mentioned, we brought the management of the leisure centres back in-house and have now established a wholly owned company, and we managed all out elections, PCC and county elections in that period. And then I mentioned before the challenges ahead. So anyone who looked at the quarterly performance report that went to Executive Cabinet recently will have seen that some of our economic indicators are off track. So we have a lower employment rate than we would probably wish to have, and certainly below target. We have a higher number of young people who are not in education, employment or training, and we are going to need to do work to support the local economy and businesses to recover. We will also need to help our community to recover. There is increased issues in terms of mental health, and use an example of Inspire Youth Zone, where there is a significantly increased number of young people reporting concerns around their mental health and issues such as self-harming. And then we need to plan on the return to the workplace, which we are well on with. We're currently aiming for a phased return starting from the 19th of July. We're taking it in a phased approach, partially because at the moment we don't know exactly what restrictions will remain after that, but also because we have developed a draft workplace strategy, which will look at how are we going to adapt after COVID to the way that that might have changed our patterns of work. That partly fits in with our shared services agenda because we have people based across different sites across Chorley and South Ribble. But it also helps us to support what our staff are telling us, which is actually they feel that they have been as productive on the whole working from home, and they would prefer to keep that degree of flexibility. And we're going to use that draft strategy as a basis for balancing the needs of the organisation for people to work in a particular way and the needs for our staff to work in a particular way. And I've probably been talking too long, but I'm done now, John. So over to you, Chair.
Thank you very much. Would anyone like to ask Chris any questions about what's been happening this last year? I mean, reading this report, everybody's done a fantastic job, fortunately, and you should be very proud of what you've done. Anybody got any questions? Yes.
Thank you, Chair. It's clear in the last year, Chris, there's been some success stories, which is great. Some areas of challenges going forward that we can think about what we've learned, what works well. But there's potentially also areas where we've failed, bordering on negligent. I know you raised a few times there, Chris, things like continuation of core services, that we are delivering as much as possible that we can. Just relating this to one of the issues I've had from my constituents in council housing, for instance, who, of course, I don't expect you to answer a single individual case, but they have had problems with things like damp and the walls literally falling down in their house. And they've complained to the council about it, and the council have said because of COVID we can't come in and do the necessary work, even though she's got 2 children, one with asthma, and she's living in a damp house, and the carpets have rotten away. So when you said there that people are ringing the council to find reassurance, that's clearly not universal. So what could we do in areas like that, Chris, where clearly there have been failings, as we open up, as hopefully we become, we enter a post-pandemic world? What can we do where services have clearly failed to remedy that as quickly as possible? Thanks.
Yes, we will always have areas where actually we need to get better, and there will always be cases where we do not deliver the service that we wish to. Specifically in relation to COVID, there were challenges at different points in the year around how we could get access safely into people's homes, protecting the members of staff and also the residents there. I would say that actually as an organisation we've had in place COVID safe measures for enabling that to happen in most circumstances for most of the last 12 months, albeit that there will sometimes be some challenges. My suggestion would be that actually if we come across cases like that, either as councillors or senior officers, that actually it is about escalating it, and it's about raising and saying actually that, you know, I'm really concerned about this, because generally there is a way that we can find to support individuals and to undertake those, particularly when it comes to social housing that will be managed by a registered provider. Not only do we have some enforcement powers, which I suspect is where that resident will have been to, we do also maintain a relatively close, I look slightly at Councillor Lee's got quite a long experience of maintaining relationships with our main registered providers, but we can challenge them as well, because a lot of that will be about the landlord needing to improve matters, and we can use either our enforcement powers or our relationship to be able to get that better. But yes, I would always encourage that if we are finding those issues and they've been raised and they're hitting a dead end, that the relevant director will always want to look into that case.
Any further questions? Yes, Councillor Riggett.
Thanks for the report. I thought it was really interesting to listen, and also really heartwarming as well. I just had a couple of 3 questions. If I do them all together, I don't think any too detailed and challenging way. I'd want them one by one. So my first question is, when you put a need for recovery, I think that's a really interesting statement. So what I'm asking and thinking about is, how are the staff? How does the organisation feel now? Because I think everybody's gone through such a lot that, you know, that need for recovery, I think, is a really interesting statement. So just wondering how you think that's going to play out in effect of council services, of the staff as well. I wanted to mention the LRF because I've seen that from the other side. Obviously, I've been elected here for a few weeks, but I was, on the county council and saw it from that side, and I thought that brought a lot of positives for Lancashire, for relationships. I think people are very keen to hold on to those contacts we've made, those new ways of working. I want to ensure that kind of thinking is embedded in the work that the council is doing, because I think there's now more of a willingness to work together and think about how can we do this with somebody else rather than each individual organisation thinking, how do we solve this problem? It's the old thing, more hands together, So I'd be interested to hear the council's views on that. And also, I just wanted to mention Surely Together. I signed up for that programme, worked to help the guys at the youth zone, or the girls, doing the shopping and delivering it. And it was a great experience, and they were really committed. It was fantastic what they did. I could see the way they just dropped what they normally did for a living, what they were normally doing and what they were providing. It made a real impact on people. So the only thing I would say, and I don't want it to come across as a criticism, but I don't quite know how else to phrase it. I signed up for Surely Together with Chorley Council, who signposted me and said, can you go and help out as part of this? I never heard back from Chorley Council again about that. When the Youth Zone project wound down and they said, okay, we think we've reached the point now where we're no longer needing to shop for vulnerable people, because I think we'd hit that end of that first big wave, and there was more infrastructure in place. They sent a very nice note and thank you. I never heard from the council, and personally that was fine. That wasn't a problem for me, but I've always found running volunteer organisations and asking volunteers, I think the most important thing you can do is say thank you, because that encourages people to come again and understand why they signed up, and you appreciate it. I know the council probably had a load of things to do. I suspect somewhere there's possibly still a database of loads of people who signed up to the council to help in any shape or form. I don't think it would be too remiss of the council just to drop them a note. We get letters from the council on all sorts of other things. I just don't think it's the kind of thing that I think could be done and would be a nice touch. People maybe reflect upon or show people, look back at some time and say, what did you do when that happened, 10 years ago? Well, I did this, and the council sent me a lovely letter saying thank you. I think that was it.
I'll start backwards and I'll start at the end and work backwards. I absolutely agree with you. Surely Together is something that we are going to want to maintain as an idea. So that's definitely something I can feed back to the team. And actually, I suspect that they'll be really pleased to do something to recognise those, because you are right, we will have the details of people who went off into different organisations to provide that support. So we'll definitely pick that up. In terms of LRF and relationships across Lancashire, I would absolutely agree with that take, that Lancashire has always had a slightly frosty relationship between each other, sometimes working well, sometimes not working well. I think it proved actually that working together can really make a big difference. And having attended a couple of chief executive meetings on behalf of Gary, it is something that certainly at very senior officer levels, people are very keen to do. I know that there is also a keenness from within the political leaderships of all of the councils to continue it. So I would anticipate that actually we will see that as the dust settles from the elections and people start getting back round to thinking, what does this mean for Lancashire? I think we'll probably see that. And then in terms of staff morale, it's something that we've been really conscious of as officers. We know that we've tried very hard to say thank you to people and make sure people are okay, but actually you probably can never do enough of it. We have undertaken a survey that we call a pulse survey, so we do full-on staff surveys, but we do that every couple of years. We have undertaken a pulse survey in the last few months. What that indicates is that the vast majority of people, 80+%, are happy, and they're still happy. We have got around about 9% who reported that they feel that their health and well-being isn't as good as they want it to be at the moment. We're now developing, and we already were, but we're now concentrating on, well, how do we provide those plans to support people who aren't feeling that? That includes everything ranging from the managerial support and looking at how do we resource this, through to kind of counselling and other occupational health offers that we have. And I think it's also really important to say that at Chorley, I think we took a slightly different approach compared to other councils when it came to some of the longer term pieces of support that we bring into the communities. So you will have noted that I said before that we've created a new team to do track and trace. We did that very deliberately because we recognised fairly rapidly, kind of as we got into July time last year, that people were not going to be able to sustain doing their job or doing an entirely different job, and people needed some more certainty. And so where it's been necessary, we brought in additional resources. Our business team have been hugely busy and continue to be hugely busy. We've supplemented some resources within the finance team who are helping process the grants, because actually it was putting pressure on people. That pressure is still there, but it has been considerably eased because we brought in additional resources. And that was a decision we made pretty early on into the pandemic. And I think it's worked. I mean, the staff survey, the pulse survey would suggest that people are feeling jaded and tired, but I think that's probably pretty universal at the moment. But most people are reporting actually they're pretty satisfied with their job and work.
Okay, Councillor Khan.
Thank you very much, Chair. It was just on a positive note regards the food parcels that the council had provided in the response, how all the diverse communities were involved, and even our refugee families had all got involved with each other and helped provide this service. And I think it promoted a lot of integration, so that was really good to see. Thank you.
Dean, I think you just need to press your button. Yeah, I would agree. And actually, in terms of the Syrian resettlement programme, obviously that had a massive risk that it was going to be very, very disruptive to some very vulnerable families. And actually, it was challenging. The team did a brilliant job in continuing to make sure that they were okay and they were keeping up with what was going on with the pandemic. But as you say, the families themselves provided a great network to each other and did get actively involved in supporting their local communities.
Any further questions from anybody? Yes, Councillor Levitt.
Yeah, thank you, Chair. Very proud that our vaccine centres in our ward and I visited there on Sunday. Very proud that we've got that service and to hear that it's being used very well. Have we got any indication what vaccine uptake is across the borough so far?
I won't give you an exact percentage because I'll get it wrong, but across the borough, Chorley is currently doing better than the rest of Lancashire. I have a feeling it was around about 90%, but don't hold me to it when I turn that I'm wildly out. But Chorley was doing better than the rest of Lancashire. There are some areas of the borough that had slightly lower vaccination rates. I don't think it'll surprise members particularly to hear that it's generally in the more deprived areas. So Chorley, East Clayton Brook particularly. But again, that's where we've been working with our public health colleagues and NHS colleagues to encourage ideas around how do we get into those communities, because from our point of view, we view that access is a challenge. Obviously, the Friday Street Health Vaccination Centre will help with that. But we continue to push and advocate for making sure that we get into communities.
Okay. Any further questions? Can I just finally ask, business grants, are they now completely dealt with and everybody happy?
I smile because for the last year, we were doing meetings where we feel like, well, this is it, and then additional restrictions would be made and a new grant would come out. We are getting there, but there is still a fair number of schemes that are still open and we're still processing. And obviously, from our point of view, from a Chorley perspective, we want to absolutely maximise the amount of money that we get out of the door, because I think in the words of the leader, he doesn't want to send any money back down to the government. He wants to have it out in the local economy and in local businesses. Now, some of that won't be possible because the criteria that's in place doesn't allow that to happen. And some of the amounts of monies that we got in the initial phases were based upon estimates, and actually those businesses may not be at that level. So not quite is probably the answer, but we're continuing to work and we're maintaining the resource that we had in place to keep that grant work going. From the council's point of view, actually, even once the grant programme is closed, we will have a significant amount of reporting. We've been doing a lot of reporting back to government. We will also need to undertake some post-grant assurance work. So we will need to back check and see that did we process those grants, because that's what the government will require of us. So So actually that work will be ongoing.
Have people been very patient if they haven't got the grants? Have they been abusive with you, or have they tolerated, you know, saying that, you know, we're working on it and get the money to you as quickly as possible?
I don't think, well, I think that there's been some challenging conversations. I wouldn't say people have been necessarily abusive. I think that we bear in mind that anyone who's at the end of the phone chasing for grants is probably chasing their livelihood. And so we understand the pressure that people are under. And we also understand that sometimes we can't process grants as fast as people want because we might have been waiting for government guidance or setting up processes. But our aim is to process as quickly as we can and to understand the grant criteria as quickly as we can. And the reality is that often where people chase, it's because we're waiting for some information, and so actually that's the tone of the conversation, is us supporting them to apply in the right way to meet the criteria.
Okay, any further questions? Okay, can I just say, as said previously, you know, well done for the work you've done this year. You've done a fantastic job, and pass our congratulations or, well, wishes to all the staff for the work they put in, really. They've gone above and beyond their normal remit, and well done to them. So thank you very much. You want to depart, Chris, or are you going to? Okay, thank you. Can we move on to item 8, which is the annual report of our work that we did last year? I don't know if we've had opportunity of reading the report, but for the new members, it is worth looking at, just to see the amount of work that one does in a year. You don't realise until the officers make this report for me and Roy how much work we do. The work the task groups do when we start with the task groups, and what we do at the Overview and Scrutiny Committee. So I do want to thank our officers for the work they put in to get this report. Thanks to the Cabinet members and the directors for their help during the year. We do put under quite a bit of pressure, and they do come up trumps with the work that we do want to do. So thank you for that. Are there any questions on the last year's work? Well, all right. Yes,
Me.
Okay. Sorry. Good evening, Councillor Molyneux.
Good evening. I managed to get to you. I'm just going to say, actually reading the report, it's interesting to see how much we have done over the year. So, and it's worth reading to actually, you don't realise how much work we do cover in the year till you actually read the report. So, yes, thanks to everybody involved.
Thank you. Yes, I agree. Until you do read the report, you don't realise what's gone on during the year, and we do fill our time up. So thank you for everything again. So, are you happy to? Is it for noting? Yeah. Are you all happy to the officer to note the report? Thank you. And so we'll move on to item 9, which is the work programme for this coming year, and it is essential that we get ourselves cracking on some of the topics you wanted from the training evening we had. Quite a few people came up with some suggestions that we should do. But before that, I'd just like to say a few words about the committees. We had a performance panel meeting last week where we had a director in front of us, Asim Khan, to talk about his directorate and the cabinet member. And then the other item on the agenda was the corporate policy quarterly report. And there were some comments as though we should have officers, cabinet members there in case there are any questions. And since then I've had a chance to discuss with various people about it, and we did come to the conclusion that we aren't there really to challenge the officers and the cabinet members. It's a question of perusing the corporate strategy and checking that things are going according to what should be happening. For example, 2 years ago, 3 years ago, over consecutive corporate policies quarters, we found the sickness rate of staff was going up. So from those two reports, we decided to have a small task group. We looked at it and we came up with some recommendations, and we found that the next quarter down, the sickness, because of the new policies we put in, sickness levels went down. And this is what we've got to look at, that over a period of time, the red stickers, if they aren't becoming amber, then we should be looking to find out why the red stickers aren't moving up to the next grade. For example, I think over the last 2 quarters, the bin collections have not reduced, and it might well be when we come to the next quarter, if they haven't reduced any further than the last 2 quarters, we will then suggest that we have a scrutiny committee to look at these figures to find out why things aren't moving upwards or downwards, as the case may be. So we've decided that we will continue as we have done this past year, and hopefully the committee will accept that. I've just got one apology to make, that I did not bring in Councillor Lowe to give the report, and the cabinet member in future will give the report of that directorate, with the director there to answer any questions that the cabinet member can't. So that's regards the performance panel, and I hope by the next meeting we've got some improved figures from what we had this last quarter. So can we go on to the work programme for this coming year? We haven't got any work organised or any task groups, and it's a question of what, as a committee, you would like us to look at this next year. Some suggestion we put forward at the training session we had 2 weeks ago. For example, enforcement was something that was suggested. Continuation of the task group that came up with the transport task report, where cycling was discussed but not went into any detail. It might well be that we can ask Kim to take this further forward and have just one meeting to look at cycling. So it's a question of what you would like to sort out with the officers. No suggestions. So, well, can I make some suggestions then, that we sort out a task group for... Sorry,
it's me again.
My apologies, Councillor Molyneux.
No, it's quite all right. It's me again. I mean, the one for Select Move that I put forward, I was just thinking of actually looking at just a one meeting one at first to see. It's as you said, things slip, because we did a very thorough report a good few years ago. But recently, we forget, I've been hearing in various places of things going on that we thought we'd addressed. So that was the why I put that one forward.
Right. Okay.
Just a short one would do, initially.
Yeah, I mean, I think you mentioned Select Move at the training evening. We have had a report of that. It is worth refreshing that, and it might well be we can do that at the full scrutiny committee at the next time we meet, if that's all right with the committee. Are you happy that Kim can start looking at the cycling and pathways in Chorley as a task, possibly over just two meetings to come up with a report? Are you all happy with that? Anybody got any comments to make of it? So that's two. Another suggestion has been made. Where's my bit of paper? Enforcement was one that quite a lot of you mentioned. Enforcement from the planning department, looking at enforcement of the planning decisions that have been made, and also enforcement from the Environment and Health Committee, where they go out to deal with problems of noise and litter etc., whether they're getting the work done correctly and what have you. So, yes.
Yeah, I'm very much in favour of looking at enforcement. I was particularly interested in how, whether we've got satisfactory capacity, particularly out of hours and at weekends. And that was the main focus of my inquiry about it. Also very, very keen to take up the cycling. I must declare an interest. It's my normal mode of travel. And I didn't know whether there was a place for looking at where our health services go after our report we got back from our lead member, whether or not at the local level we should give it some scrutiny, just to make sure that we're not sort of left behind and having decisions made that we weren't really satisfactorily involved in.
Okay. Yes, Councillor Regan.
Thank you, Mr. Chairman. All I wanted to add was, I know we missed it at the original planning meeting, but when we had the first performance panel, I think 3 of us independently raised concerns about recycling and the demand for recycling now from residents. So I know we've got a long list of issues, some of which are long-standing and definitely need looking at. I also feel we need to be flexible enough to respond to issues that are coming forward at this time. So I think there might be some value in looking at the demand from households for recycling, especially cardboard, if the changes in working patterns that we've talked about with our staff, let alone are replicated across the borough. I think it might be quite timely to get that on earlier rather than later. So if we do need to make any changes to our services, we're looking a bit more proactive and a little bit less reactive to it.
Yes, I think quite right. I think it's a question of, like I mentioned about recycling. If the recycling results aren't any better for the next quarter, then we should certainly look at it, really. And I agree that the cardboard situation is something we should be probably looking at when we get the results of the bin collections. Yes, Sarah.
Hi, apologies. I wasn't on the original training session last week. I was attending another meeting. However, I have done the training with Darren and Matthew last night. I have got another suggestion for potential topics for future reviews. Would I be able to introduce that now for you?
Yeah. I'm having difficulty hearing, really, so.
Sorry. I would just say, I wasn't, do you want me to stand up? I was just saying that I wasn't on the original training last week because I was attending another meeting. However, I have completed the training yesterday evening. I have another topic that I would like the Scrutiny Committee to in the future. You hear me? What it is, I would like to add another potential topic for future reviews. Would I be able to introduce that? Yeah, thank you. It was just about, there is an issue at the moment within Chorley and wider Lancashire area just regarding the criminal justice system and the backlog at the courts in the magistrates and the Crown. I know that they are looking at the moment at looking at opening more Nightingale courts up around the area. I know they are closing one at the moment. The issue is that when you go into hearings aren't taking place till a year later, and then some dates are getting fixed for areas not out in the area in Preston. They're getting fixed out to outside areas where if people are having issues getting their own local transport, or they don't have they have a very low income, then it's very difficult for them they can't afford really to go to outside areas like a place like Burnley or Lancaster. It can be quite difficult for them. So I was just wondering if we would be able to invite at a future meeting, invite somebody from the Lancashire Magistrates Courts to have a possible look at opening up a court, an Nightingale court in Chorley and South Ribble area.
We can look at that at probably the next scrutiny meeting as just a one-off item, and see what we can come up with, really. Is that okay?
Yeah, that's great. Thank you very much, Chair.
You?
Councillor Kim Snape would like to say something. Councillor Kim Snape on Teams.
Right, okay.
Hiya, sorry, yeah, it was just to back up what Julia was saying, really. I mean, I suggested it the other night at the training meeting, but I would really like to look at enforcement. I'm not bothered whether that's like a task group or a one-off meeting. I just think both in terms of the capacity of the staffing team for enforcement, any targets and performance indicators that they have, because I've never seen any. I mean, I was told by somebody the other week that they're supposed to respond to enforcement complaints within 6 weeks, and I definitely don't think that's happening. And also how the enforcement sort of team stroke process sort of interlinks with the general public and with councillors as well, you know, and how we can better improve that, really, because I do think that that's slipped over the last 12, 18 months, 2 or 3 years, really. So that's just my thoughts. Thank you.
Yes, thank you for that. Well, we've got enforcement, we've got cycling, and we've got select move. That's probably a good start, and what Sarah just proposed. Can you leave that with me and the officers to sort out either a task group or for the next agenda? Are you all happy with that?
Yes, Chair.
Yes. Are you proposing those four to get cracking with?
Just bear with me, Chair. I'm just probably pulling you up for not mentioning health that I'd indicated was an area that we might want to scrutinise.
Right, okay.
I mean, the health changes and how it's going to impact us in Chorley.
Okay.
Right, thank you, Chair. Just looking at the crime and disorder scrutiny, have we got any topic for that?
For the what?
Crime and disorder scrutiny.
Well, that's usually done with it in conjunction with South Ribble, where we have the crime and disorder. We meet once a year as a scrutiny with South Ribble, where the police can discuss problems in the area.
Okay, so that's different to what we did a few years ago. Safeguarding.
That will be on the programme during the year.
Okay, thank you.
So are we all okay with it, with those four suggestions to sort out for the next meeting, and the officers will sort out a committee for the task groups? Okay. I have not got. Can I just say thank you for your patience tonight? I don't pick up everything that people have been saying tonight with the microphones, etc. I'm looking forward to, hopefully, the next meeting, task group, and also the performance panel, that will be back in the members' room, where hopefully we don't need microphones, we can hear what's going on. So my apologies if I haven't picked up everything tonight. So thank you very much. Safe journey home. Enjoy the summer holidays.